Morning everyone, Dr. Brian Steiner here at Wilkins Spinal Care with this week's Facebook video. First off, I want to thank everyone for all the engagements, the posts, and the comments on last week's Facebook video. It definitely went viral. It was really huge, and I appreciate all the support that you all had. Just to recap last week's material, we talked about disc injuries, and I did a video with one of my patients demonstrating the decompression table, which has been very successful not only for her, but a lot of other patients that we've had over the years. If you have any questions regarding last week's material, please feel free to send me a message. I will still answer any questions. Post on that post. I still have it up on Facebook. Now, for this week, I said I was going to try and get a patient to demonstrate the Hockenman machine, but just how everything worked out in timing, just when they were coming in, I had patients to see, so I unfortunately couldn't do it this week. So I'm just going to do what I usually do and just talk a little bit about our next topic, which is peripheral neuropathy. So when we talk about peripheral neuropathy, we're going to go back to the first couple of weeks that we started these videos. We're going to talk about the peripheral nervous system. Peripheral neuropathy is when there's damage to the nerves outside the brain and the spinal cord. So it's when they go out to the arms, the hands, the fingers, and down into the legs, knees, and feet and toes. They're allowing us to move and they're allowing us to feel. When there's damage to these nerves, that's when we start to see numbness, tingling, burning sensations, sharp pins, needles, things like that. Now, why does this happen? When people hear peripheral neuropathy, they think diabetes right away. Now, a lot of high percentage of people who are diabetics do have peripheral neuropathy, but there's over 150 ways for there to be a cause for peripheral neuropathy, such as traumas, infections, tumors. A big one is nutritional deficiencies. Another huge one is alcoholism. There's so many different ways how people can get peripheral neuropathy. Now, how do we diagnose it? You need to do an orthopedic examination, a special test for peripheral neuropathy to help diagnose it. So now, how do we prevent it? So basically, just like everything else, you do the exact opposite to prevent it. Don't drink that much. Eat better. Make sure you get an abundance of nutrients, minerals, vitamins to help that immune system grow. Traumas. I mean, you can obviously prevent traumas, but again, we're Americans. We do traumas a lot. Now, for infections, you can prevent infections, obviously, but tumors, unfortunately, you can't prevent tumors. Well, you can in a lot of cases, but some cases you can't. So some of these things are just unknown causes of how they happen. Now, how do you manage it? Unfortunately, most cases of peripheral neuropathy are not treatable. However, they can be managed. A lot of people will resort to medications. A lot of them will resort to creams that help. Sometimes this stuff helps, but again, we're chiropractors. We try to help you with a natural approach. The reason why we try to treat with a natural approach is because there's still unnecessary nerve interference that can help the body fight off as much as they can. It's not eliminating it, but it can put it into remission. Now, specifically here at our office, we have something that I talked about a couple minutes ago called the Hockenman machine. The Hockenman machine is very similar to electric muscle stimulation. If any of you have had it, you put the pads on and it causes a muscle contraction. The Hockenman is a little bit different. The Hockenman has those pads and it has that charge, but we're not looking for a muscle contraction. And essentially, we want that to penetrate through the skin and to change the biochemical factors in the body, trying to reduce the pain. And a lot of patients have gone into complete remission, and we've managed it the best we can. We've had the Hockenman machine for a very long time. Now, we supplement it with the chiropractic adjustment because, again, there is still nerve interference there, and we want to remove that nerve interference. So just like we do with the decompression, we're still going to adjust you. It's a lot powerful, and it's a lot more of a supplementation to help you along with the adjustment. Now, obviously, there's things that you can do, such as eating correctly, exercise correctly, because, again, nutrition is also a big factor on all this. We have nutritional supplements that can help with neuropathy and help manage the nervous system to function properly. Now, that's all I have for you guys this week. Now, next week, we're going to start, we've been a little bit broad the last couple weeks. We talked specifically about decompression. This week we talked about peripheral neuropathy. Next week we're going to focus on one area. So I'm going to start with the neck and I'm going to work my way down to the back. So let's start with the neck, and next week we're going to talk about carpal tunnel syndrome. Now when I hear carpal tunnel syndrome, you hear the wrist. But we'll get into that more next week on why I'm talking about neck issues as well. So that's all I have for you guys today. As usual, I have sources for you. I'll go ahead and put it on the Facebook page once I post this. And if you have any questions, feel free to send me a message. Have a good day. Bye.